on aches and pain during pregnancy. I have an experience of around 8 years in the field of obstetrics and gynecology with fellowship in infertility and laparoscopy. William Shakespeare has said, pain is the payment for the precious thing, and so is in the pregnancy. However, not all pains and aches are to be paid during the pregnancy. During pregnancy, there are a lot of hormonal and physical changes which takes place during the first half and the second half of the pregnancy respectively. It is the hormonal changes which might cause little the soreness of the breast, the heartburn, which is usually experienced during the first trimester of the pregnancy. As the hormones relax the muscles and the ligaments of during the pregnancy, you can have experienced pains like pain in the back, pain in the legs. There is a stretching kind of pain in the abdomen, which is because of the uterus, the support of the uterus, that is the round ligament which is stretched, and it causes the pain. Also, as the belly grows, the center of gravity moves ahead, and the muscles which abdominal muscles which support your back and spines, they are stretched and weakened. And that is the reason when we have usually the patient complains of pain in the back and pain in the spine. It is almost two-thirds of the pregnant women which usually experience pain during the pregnancy. So now, what kind of pain should we worried about, and what kind of pain we shouldn't be worried about, and what are the further management for the same? During the first trimester, a patient might complain of headache or something like pain in the chest, which is usually a heartburn. A headache, normal headache, which can be relieved with normal medication or home remedies, need not to be worried. However, if it doesn't go away with the normal medications, we need to report to the hospital and meet your doctor. Usually during the pregnancy, there is a state of hyperacidity, and because of which there is heartburn. Also, keeping the stomach empty for longer time will cause increase in the hyperacidity. So we should always eat every 2 to 3 hours during the pregnancy. A small meals, but a frequent meals are advisable. When the pain is associated with something like bleeding through the vagina, giddiness, uneasiness, you need to report to the hospital because it could be signs of something like ectopic pregnancy or something like miscarriage, which shouldn't be missed by anyone. During the second half, in the early from the 14 weeks, as the body starts gaining weight and there is stretching of the muscles and the ligaments of the uterus, there is usually mild cramping pain in the abdomen, which can be relieved by taking cold presses or hot fermentation, a simple medication, and the best is tender love care from your partner or from your mother or any other family members. However, a pain in the pregnancy during the second half can be also due to some serious conditions, like it could be associated while passing urine, which could be a case of urinary tract infection, or something like other any other medical conditions like appendix or torsion or anything which might be new to this. This all kind of pains need to be reported to the hospital. Patient should immediately consult a doctor for the same. Do not sit at home and try to relieve the pain with more than 2 to 3 hours of incomplete relief of the pain with the medications. Coming to the third trimester, the pain could be indication of a false labor pain, or it could be indication of the small kicks of the baby, which is called as Braxton's Hicks. Usually, how are the labor pains start? The pains usually start from the back, and they are not continuous pains from the back. It starts to in the front, and it is at a frequent intervals of the pain. As the labor progresses, the intensity also increases, and so the frequency of it. It might be usually associated with leaking PV, that is the discharge, which is like watery, or something like a mucus plug containing little pinkish brownish discharge from there. Those are the signs of the labor pain. However, any kind of pain during the third trimester, patients need to report to the doctor and to the hospital to confirm whether she is into a labor or she is just it is a false labor pain. None of the pain should be taken casually by the patients unless it is very easily relieved by the normal medication. Now, what are the other forms of pain which we usually get? The pains of the uterus being stretched, the ligaments being stretched. As the round ligaments support the uterus, there is the stretching of the ligament, and as the pregnancy increases, that there is a pain. It could be a sharp pain, which is called as a round ligament pain or a groin pain, pelvic pain, which can be easily be relieved by a normal medication such as paracetamol. What else can be done to get relief of the pain? A pain can be relieved by walking. You need to be active, you need to walk, you need to do little yoga, you need to do little exercise of lifting weights. But all these things can be done under the supervision of a proper instructor and under the guidance of a doctor. However, some conditions like having a low lying placenta, or probably having a short cervix, or having twins probably, are the conditions when your doctor might not advise you to do following exercises. And thus this pain during this conditions, whenever there is pain, please don't practice any of the exercises as advised unless you are under the supervision of your doctor. The best remedy for the pain could be having a tender love care from your partner, from your mother, or from any of your family members. As being happy all throughout your pregnancy is one of the most important factors which would relieve all your pains and aches during the pregnancy. Also, please take proper medications as advised by the doctor, and medications only and only advised by your gynecologist, like taking calcium from the second trimester, taking vitamin D from the first trimester as advised by the doctor, and taking iron tablets as advised by a doctor from the second trimester. It is usually the baby who receives vitamin D and calcium from the mother. So, unless you are properly having a good reserve for that, the baby wouldn't be getting. Also, as the baby has a tendency to take nutrition from the mother, if you are in the deficiency of the following vitamins, automatically the calcium and vitamin deficiency would be there, and then you will be start having the experiencing all kind of pains as we have told. Also, have proper intake of water, electrolytes, as electrolytes imbalance usually cause what is most common as the leg cramps, which is very common. Also, taking proper multivitamins containing folic acid and vitamin B12 would relieve the pains of which we usually get patients complaining like tingling and numbness sensation in the hands and legs. Also, during pregnancy, there is slight swelling in the body all throughout because of the water retention. And that time, when you have usually experienced something tingling and numbness sensation in the hands and the fingers and the toes, that could be a signs of something called as carpal tunnel syndrome. When such things are there, please report to the doctor, because we shouldn't miss on the important medical disorders during such things. Any kind of pain not relieved and associated with uh, any other physical symptoms, like not able to raise your hand or not able to move your legs, or there is quite swelling in the legs, or any other pain in the abdomen, pain associated with vaginal bleeding, pain associated while passing urine, pain associated while with vaginal discharge, should be definitely reported to the hospital as soon as possible, because this could be the chances of some other infection or other comorbid conditions which could be missed, and which would lead to a very bad effect not only on the mother but our precious baby also. Hence, I always advise, please, any kind of pain, we doctors are always over here to entertain you, our pregnant females, all the time, whether it is day or night, 24/7. So, any kind of pain, irrespective of whether it's a normal pain or a general pain or a serious pain, please consult your doctor before taking any medications and any remedies. Thank you. My take home message will be, please consult your doctor, follow your doctor, and follow us on Baby Chakra following our referral code Dr. Freni. Thank you. Any questions? Uh, yes, kind of it is normal for your body to ache during pregnancy. Yes, especially during the first trimester, you will usually experience this because of the hormone called progesterone, which will usually have the effect of soreness of breast, which is very common. Secondly, we are not usually not everyone is prepared for the same during the pregnancy, so we usually lack in taking multivitamins, and that is when the body we realize that yes, we are lacking in multivitamins and folic acid and all, and that's why we have body ache. But as I told you, when the body ache is associated with anything like cold, cough, fever, burning micturition, or any episode of other like cough or anything, you need to report to the hospital. Miss Preeti has asked, doctors, my legs are swelling a lot. Is it normal? Swelling of the legs is kind of normal during pregnancy, provided in the evening when you keep your legs on two pillows and sleep, it goes off. However, it is abnormal when it is associated with something like having high blood pressure. You need to increase the protein intake, and you need to do some blood tests and consult your doctor for the same, the swelling of the leg. Miss Vandana has asked, Doctor, gaining weight, does that affect lot of pain during pregnancy? Yes, it will, because during the pregnancy, the hormones they cause laxity of the joints and the muscles, and gaining too much of weight will put weight on your joints, and that will definitely affect your joint, and you will have the pain during pregnancy, especially in your legs. That is what it is called. Mahesh has asked, Doctor, my wife just keep on sleeping, and when she gets up, she has complained that she has a body pain. Do we need to start with any tablets? Sleeping during the first trimester, a pregnant woman will feel that she is sleepy. That is definitely normal. But getting up, she complains of pain, body pain. So, do we need to start any tablets? The multivitamins and the tablets of calcium and iron needs to be started definitely as per the advice by your doctor. And we need to consult your doctor if it is not going even with your multivitamins and normal medicine for the pain. And probably, Mr. Mahesh, your tender love care would help to relieve her pain. Miss Naina has asked what kind of fruits we need to avoid during pregnancy. Ideally, it is said that raw papaya and pineapples are to be avoided. However, taken in modest condition during the first trimester, they usually cause no harm to it. But still, we should be careful while taking it. With respect to the season of mango, you can definitely take a mango, but that too in a proper amount. You can soak a mango in water a night previous, and the next day you can have it. And rest of all the fruits are all okay in the during the pregnancy, provided you are not diabetic, you don't have pre-gestational diabetes, or any other allergic to the any of the fruits. Puja, are exercise okay during pregnancy? Definitely, you need to do exercises and some yogas during pregnancy. A walk would be better while doing when you are pregnant. However, this all exercises and yoga and walk are to be done under the supervision of an instructor, or as after consulted your doctors, because some of the conditions, as I mentioned earlier, like short cervix, or probably sometimes having twins with short cervix, or other conditions like having low lying placenta, wouldn't allow you to do exercises, but walk at least 30 minutes a day would. Okay, sorry. Swimming also can be done during pregnancy, but as I told you, after getting a green signal from your consulting gynecologist. Miss Yogita has asked your doctor when we need to start with medicine during pregnancy. Ideally, it is a planned pregnancy, you need to be started on basic multivitamin and folic acid before pregnancy. However, as the pregnancy is a surprise for you, so you need to start with the folic acid and multivitamin from day one of your UPT being positive. And then as the pregnancy progresses and if everything goes well, by the second trimester, at least that is around 13 to 14 weeks, we usually start you with iron and calcium tablets. And if your food intake of protein is not well, then we usually prefer you starting with some protein powder or protein biscuit, whatever is your choice. Doctor, is labor very painful? Good question. Uh, as I told you, there is no gain without pain. Yes, labor is definitely painful, but then we have something called as epidural anesthesia, which will make your labor journey very eventful with less of pain, because it is a kind of anesthesia which is usually given through the back through some medications, which lowers your perception of pain during the labor, but the process of labor goes on. And it all depends on how you have been taught and how you have been explained regarding the labor and how you take it. Then the labor pain is less painful, as ahead is the journey where you step into the motherhood and you have a beautiful baby girl or boy in your hand, which will make it less painful. Last way. So we are done. So I'm really grateful to Baby Chakra and Miss Naina for this opportunity where I can guide all my pregnant female friends through their journey of pregnancy and having entering into a wonderful motherhood journey. You can connect me through Baby Chakra, and please follow me on Baby Chakra by using my referral code, not only for good products but also this awesome activity which they have taken up of explaining and letting the pregnant females understand what exactly pregnancy is, not only the labor pain but also the other activities and other things related to the pregnancy. Thank you, Miss Naina, and thank you, Baby Chakra.